Immediately following the procedure, you'll be given gauze to help control the bleeding in the area. This gauze can be changed every 30 to 45 minutes. To replace the gauze that will be provided to you immediately after surgery, you'll run it under some cool water and squeeze out the extra water and place the gauze towards the cheek and use firm biting pressure in the area where the tooth was removed to help control the bleeding. Some bleeding is to be expected for 12 to 24 hours following the procedure. Each pain regimen is going to be uniquely tailored to every patient, and we will discuss what options are available to you in order to best manage your pain. But typically a non-narcotic pain regimen including ibuprofen and Tylenol is prescribed, and a small amount of a narcotic pain medication like oxycodone or hydrocodone is prescribed to supplement this non-narcotic pain regimen. Additional instructions will be provided for each patient during their consultation. Our goal is to make sure that you're comfortable after your procedure in the safest possible way. Immediately following the procedure, ice can be applied to the jaws to help with pain and swelling in the area. It's not required to place ice in this area, but many patients find comfort for that. When applying ice to the jaws, we recommend applying the ice for 20 minutes and then removing the ice for 20 minutes and repeating this cycle. After 24 hours, heat can be applied to the jaws to help resolve some of the swelling in the area. To apply heat to the jaws, we recommend taking a dish towel, running under the sink, wringing it out, and placing it in the microwave until it's warm to the touch and it can be applied to the jaws. Immediately following surgery, it's critical to start eating again. We recommend avoiding foods that are crunchy, difficult to chew, or have small bits and pieces that could irritate the surgical site. After 24 hours, it's okay to start to move to a normal diet, but typically it will take patients 4 or 5 days to have the comfort level to start to return to a normal diet. I think the best rule of thumb is to listen to your own body and to see what's comfortable for you, and to not to push yourself too much, and then slowly resume a normal diet over the course of 1 to 2 weeks. We recommend waiting about 4 days before returning to work, and I would recommend returning to light duty work only and to avoid any strenuous activity for at least 1 week, preferably 2 weeks. We recommend waiting at least 5 days before resuming any moderate physical activity. In any activity that might be irritate the jaws, we would recommend waiting at least 1 week. Examples of this would be playing a musical instrument. We will discuss any recovery at the time of your consultation, since every procedure and every patient's recovery might vary. It's important to return to brushing and flossing quickly following surgery. The surgical site is going to heal optimally if it's kept clean. Clean the areas in the mouth that were not involved in the surgery immediately, either the day of or the following day after the surgery. And the surgical site itself, I typically recommend waiting about a week before you go back to brushing that area. And the important thing is to listen to your body and listen to your comfort and any specific instructions that are given to you. The areas that we recommend that you do not brush will be kept clean with an antibiotic mouth rinse that will be prescribed to you after surgery. Bruising is expected after surgery. This bruising will change in color over time, and the bruising will be followed during the post-operative appointments. If you have any questions or concerns about your bruising, you can reach out to our office. Dry socket is not an infection. It's where the blood clot actually leaves the socket for unknown reasons. And the result of this is increased pain in the area. And while there are no long-term healing complications from a dry socket, in the short term there can be increased pain in the surgical site. You can reach out to our office during post-operative appointments and discuss your options for assisting with this pain relief while the site is healing. This may include additional medications or medications applied to the surgical site. The good news is typically the symptoms resolve within a short period of time. After implant placement, a small object that looks like a thumbtack is placed over the implant to keep the opening to the implant covered and safe. Sometimes, in rare circumstances, this can get dislodged during eating or during brushing teeth. If this comes out, it's no cause for alarm. You can keep that small piece and give our office a call so that it can be replaced promptly.